All right, deep divers, welcome back.
It's great to be back.
So, today we are taking a deep dive into Alzheimer's and dementia.
Yeah.
A topic that I think is very close to home for so many people. And it could be a topic that's really kind of scary and overwhelming. But what we're hoping to do is kind of break it down.
Yeah.
So that you come away with a little bit more knowledge and maybe some empowerment about what you can do for yourself or your loved ones.
That's the goal, right? To really arm ourselves with the right information so we can feel a little more empowered in facing something as complex as Alzheimer's.
So why don't we just jump right in?
Let's do it.
Let's start by just defining what is dementia.
Okay, so dementia is a broad term. It actually describes a whole range of symptoms that affect cognitive function. So that means things like your memory, your thinking abilities, your behavior even.
Right.
And under that umbrella,
Alzheimer's
disease is the most common type of dementia.
Oh, really?
All right. It accounts for like a whopping 60 to 70% of all dementia cases.
Wow. Okay, so it's the vast majority.
It is. It's a really significant percentage.
Wow. So Alzheimer's is a type of dementia.
Exactly.
Okay. So what causes Alzheimer's? Is that something that we know yet?
Well, the exact cause is still kind of a mystery. It's a very active area of research, but we're starting to kind of unravel some of the factors that might play a role. One really interesting area is genetics.
Okay.
So, for example, there's this gene called ApoE4.
Okay.
And studies have shown that if you inherit this gene, you're more likely to develop Alzheimer's later in life.
Okay.
So it's not a guarantee.
Right. It's not a guarantee, but it increases your chances.
It's a risk factor.
Okay.
Absolutely. And aside from genetics, age is a big one.
Okay.
The older we get, unfortunately, the higher our risk.
So that makes me feel good.
Well, it's the reality. But you know what? Lifestyle choices actually also play a role.
Okay. So this is something that we have some control over.
Exactly. And it's good news because it means we can actually take steps to reduce our risk.
Okay. So what kind of lifestyle things we call it by diet, exercise, that sort of thing?
Yeah, all of those. A healthy heart is a healthy brain, you know?
Makes sense.
So things like regular exercise, a balanced diet, all crucial. They keep your blood flowing, deliver oxygen and nutrients to the brain. It keeps those neurons firing.
It's like giving your brain the best fuel possible.
Exactly. But it's not just about what you eat and how you move. You know, emerging research has been looking at kind of unexpected things as well, like head injuries.
Head injuries, really?
Yeah, especially recurring one, like concussions, for example. You know, those can actually increase the risk of developing Alzheimer's later on.
Wow. Okay. I wouldn't have thought of that.
Yeah, it's pretty fascinating. So it's really this kind of cumulative effect on the brain.
Right.
You know, like over time, those little things add up.
Okay. So if someone is starting to notice that maybe they're being a little bit more forgetful than they used to be,
right?
How can they tell if it's normal aging or if it's something that they need to be a little bit more concerned about?
That's a really important question. And that's where understanding the stages of Alzheimer's is so crucial.
Okay.
It's a progressive disease, meaning it develops gradually over time. And in the early stages, you might experience some forgetfulness, misplacing things, you know, having trouble remembering recent events. And these things can be normal as we age.
Right.
But if they start to interfere with your daily life, that's when you really want to talk to your doctor.
Okay. And then as it progresses, what are some of the things that families should be aware of? Like what starts to happen?
So as Alzheimer's progresses, those symptoms become much more pronounced. Communication can get really difficult.
Right.
They struggle to find the right words, follow conversations. Recognizing familiar faces might become a challenge.
Wow.
Even loved ones.
Okay.
And simple tasks. Things like getting dressed, cooking a meal can become really frustrating.
Right.
Really difficult.
And it's not just memory at that point. It's really affecting every aspect of life.
Exactly. And that's why early detection is so important.
Because then hopefully you can try to slow it down.
Yes.
But there's no cure right now.
That's right. Currently, there's no cure for Alzheimer's, but early diagnosis allows for better symptom management. And there are some treatments that can potentially slow the progression of the disease.
Okay. So what are some of those treatments?
Well, there are medications like cholinesterase inhibitors.
Okay.
Those can help improve cognitive function and memory, at least temporarily.
Okay. And how do those work? That sounds very complicated.
Well, in simple terms, they work by increasing levels of a very important neurotransmitter called acetylcholine. It's basically a chemical messenger in the brain that plays a crucial role in learning and memory. And as Alzheimer's progresses, the levels of acetylcholine drop. So these inhibitors, they block the enzyme that breaks down acetylcholine. So it's like giving the brain a little beast.
Okay, so it's not reversing the damage, but it's just kind of helping it along a little bit.
Exactly. It's about supporting those vital brain functions as much as we can.
Okay, so what about lifestyle changes? Are those more for managing symptoms, or could those actually have an impact on preventing Alzheimer's?
It's a great question, and honestly, the research is still ongoing.
Okay.
But there's growing evidence that a brain-healthy lifestyle can actually lower your risk of developing Alzheimer's.
Okay.
It's about creating an environment in your brain that's more resilient to damage.
Okay, so it's about prevention too.
Exactly.
So what are some of the key things people can do?
Well, as we talked about before, regular physical activity is huge, especially aerobic exercise.
Okay.
This is that blood pumping to your brain.
It's a workout for the brain too.
Exactly. And then your diet plays a huge role. A balanced diet rich in things like antioxidants, omega-3 fatty acids.
So good fats.
Yes, the good fats. Give your brain that premium fuel.
Right. I like that.
Fuel it up. And then mental stimulation is crucial too.
Mental stimulation.
Yeah, keep your brain engaged, Like we were saying, it's like a muscle.
Oh, right.
You got to work it out. Puzzles, learning a new language, even a good debate.
Right.
All those things keep those neural pathways firing.
Keep it active.
Exactly.
It's interesting that the same kind of things that keep your body healthy,
it's all connected.
keep your brain healthy too.
Yeah.
Wow. That's fascinating. And what about people who are already dealing with an Alzheimer's diagnosis?
Yeah.
Like, are there resources out there for them and their families?
Absolutely. There's a lot of support available. Support groups are a great resource.
Okay.
They provide a safe space for caregivers to connect with others, share their experiences, learn coping strategies, and just find that emotional support.
Right. Because you're not alone.
Exactly. You're not alone in this journey.
Yeah.
And then there's professional caregivers who can provide respite care, which can be so helpful for family members who need a break, need to recharge, take care of themselves too.
Because it's exhausting.
It is exhausting.
For the caregiver.
Yeah. And then therapy, both individual and family therapy, can be so valuable for equipping everyone with the tools to cope with this.
It's a team effort.
It really is.
So we've covered a lot of ground today.
We have.
What is the one thing that you hope our listeners will kind of walk away with?
I think the biggest takeaway is that knowledge really is power.
Yeah.
And understanding Alzheimer's and dementia empowers us to advocate for more research, to support those who are affected, and to take steps to protect our own brain health.
Yeah, and I think that's what we wanted to do today is kind of empower our listeners with that knowledge.
Absolutely.
So deep divers, I hope you walk away from this conversation feeling a little bit more informed and a little bit less overwhelmed by this topic. And as always, we'd love to hear from you. What are some small steps that you're taking to improve your brain health or the brain health of your loved ones? Let us know, because even small steps can make a big difference. So until next time, happy diving.
Happy diving, everyone.
Bye.